I've got a really interesting case for you to hear today. I don't know if you've heard of a condition called dystonia, but it is something that's very painful in certain cases. Dystonia is basically a malfunction of the muscles. They're not working as they should. They're contracting too much. And so I have a patient that has a problem, and you would think, well, how bad could that be? Her forefoot and her right foot had contractures of the second, third, and fourth digits. So much so that every time she took out, in a matter of minutes, her foot would go into these severe cramping, and unrelenting cramping would not let go. This patient sought the help of multiple specialists, 2 foot and ankle doctors. She saw ultimately a neurologist and a specialist in motion disorders. Ultimately, she had brain scans, all for this condition in her foot that was so painful. So we looked at this and discovered that, by the way, she also had Botox. So I'm so happy that it turned out as well as it has. We did her procedure, as we call it, minimally invasive. I'm a board certified minimally invasive foot and ankle specialist. And we do our procedures right here, and this is my little OR suite that we do these procedures in. I'll give you a little scan here, but we're fully equipped to do surgery back in this office-based surgery center. And here we have no general anesthesia. You're given a sedative. The procedures can be done under local anesthetic. You walk in, you walk out. You can listen to music. I give you a little Valium as a sedation, and that's it. So again, these procedures, as in this case, were done with 1 stitch in each toe to correct it. You'll see also a second video where this patient had another tweaking procedure for the 4th digit, which we relaxed another few fibers of the leaders going to her toes, contracting them. And we did her big toe and her that 4th toe again. She was so happy that she's no longer doing Botox, and that she got the clearance from her motion specialist. The doctor specializes in movement, to go ahead and do these releases of her tendons. Briefly, would you just tell me your experience? You came to me and you had seen how many doctors?
5 before you were the 5th, maybe? Yeah,
5th.
You were the 5th.
And you saw, what kind of doctors were
I saw 2 podiatrists and 2 foot and ankle specialists, orthopedic doctors.
And then did you not see a neurologist as well?
After you.
After.
I came to you before the first neurologist.
Correct, right. So then describe your condition. I do have pictures of before. I don't have a video, unfortunately, but I have a picture of your toes all scrunched up and
Yes.
contracted. Explain how that felt and how it was frustrating for you.
It was uncontrollable, and my foot would cramp and toes would curl down. And I would feel, before the first surgery, I felt all the way down the arch of my foot, like just spasm almost.
And this was like predictable every day.
Absolutely. If I walked very far, if I first getting out of bed, it was okay.
Mm-hmm.
But the more I walked, the worse it got. And it would curl even, I would say, after a minute of walking. If I tried to walk for exercise, like 2 miles, it was unbearable.
So you couldn't exercise?
I could not. I had to stop. I massaged my foot and go a little more and stop and massage my foot.
Wow. Okay. So we did those initial tenotomies of the 2nd, 3rd, and 4th digits, not the big toe. And so tell us what your experience was after that.
It was immediate relief on 3 of the toes. The 4th toe was better, but it kinked.
Right.
And so that was uncomfortable, not painful.
Okay.
But the other 3 toes were perfect.
Okay.
And
Great.
then the big toe was, every single step it was bending. Every single step, just going in and out.
Kind of over
And I
flexing.
actually got like a callus on the nook below my big toe.
Okay.
And on the tip of my big toe.
So then we decided to go and do a flexor T on that one, and then what happens, we actually missed a fiber on the 4th toe, and at the same time we did the big toe, we did the 4th toe.
And it's perfect.
And so then now you're standing and your
And
toes
it's
are
not curled.
not curled up and they're not cramping. That's wonderful. That's good. And so you also said that you feel better when you splay your toes.
If I walk with my toes splayed, or if I walk with big toe down and 4 up. And then I get relief.
Okay. Meaning,
I can walk with my
Right.
toes splayed and they're not gripping.
Right.
And I'm not getting that cramp.
and now she can walk without pain. She feels a little pulling, but that's it. She's absolutely ecstatic. So much so that we went back after taking care of the worst toes. Her big toe was doing contracting, and she wanted to get that released. And there was a little residual left in the fourth toe. We went back and tweaked that, and you'll see the results. She's extremely happy with it. So there are more ways to skin cats when you have different types of conditions. For example, dystonia is something that for years, like a child with cerebral palsy or a condition where muscles are all contracted in the Achilles tendon, for example, and the foot is contracted one way or the other. And so we can do releases of the Achilles tendon and posterior tibial, different muscles that are tugging the foot in a deformed direction. And when you release those, they're relaxed and they can function better. This is no different in that we have not solved her neurological condition, but we have solved her problem where she can function as a normal person now. I hope you enjoyed this story. I'm Dr. Robert Parker with Parker Foot and Ankle and Neuropathy Care Center of Houston. Thank you.